Of the forum. Session 5 is entitled The Social Cultural Aspects of a Southeast Asian Recovery Framework. This session will be moderated by Dr. Sita Sumrit, who is the head of Poverty Eradication and Gender Division of the ASEAN Human Development Directorate at that Secretariat. She will be also presiding over the keynote speaker as well as the panelists and the Q&A session that will commence thereafter. So Dr. Sita, welcome, and you have the floor. Thank you.
Thank you very much, Pat Ronnie, and good afternoon, everyone. I hope everyone can hear me well. So for this session, session number 5, we will be focusing on sociocultural aspects of the Southeast Asian recovery framework. For the session, we will learn about the post-pandemic recovery plan, as well as the priorities of the region, as well as our partners to take us through the recovery process. For this panel discussion, we will have speakers, apart from the speaker from different fields, including Thailand, ASEAN, the EU, as well as the social entrepreneurship and academic perspectives. So without further ado, I would like to invite our keynote speaker, His Excellency DST Kumpua, Deputy Secretary General of ASEAN for ASEAN Socio-Cultural Community, to take the floor. His keynote address will focus on the inclusive and sustainable recovery from the ASCC perspectives. DST, sir, you may have the floor. Thank you very much.
Thank you very much, Sita, and a very good afternoon to all colleagues, Ronnie and all the colleagues, at ESCAP. Can you hear me okay and see me fine?
Yes, we do, sir.
Okay. Okay. Well, I'm glad, to be part of the session this afternoon, and the topic is very relevant, it's very timely. Perhaps, I should start by saying that, we are almost or even more than 10 months into the pandemic, and we still learn new things about how the virus evolve and how, it impacts our regions. So, our tasks are looking at the problems that we are now encountering, from multiple fronts. And it remains, the issues of health, and this is some things that I would like you to start talking a little bit, how ASEAN is responding to this. Of course, we've been proactive and quick, in responding to the pandemic. But even with early response to the pandemic, we can still see the severe impact of this pandemic on the lives and livelihood of our people. I would like to look at our response from four different angles. First one, of course, as I just mentioned, that this pandemic is unprecedented in many ways, the magnitude, the impact, and also the rapid spread of the virus and then infections and so on. So we've been creating a numbers of platforms to allow experts from across the world to share their best practices, their knowledge, their experience, and how they are handling this pandemic. And I hope, in the coming months, we are going to launch the portal, and that portal would be, an online platform that would allow all experts and also people who work from different fields, to engage in the discussions on how we can better, manage this pandemic, but also, to prepare ourselves for the next one. In terms of mechanisms, we are coming up with a numbers of key document guideline, for a responsive social protections in times of crisis, and COVID-19 is also part of this thinkings as well. We are now, working toward finalizing the ASEAN SOP for public health emergencies. We are also coming up with, a mechanism to mobilize resources as well, such as the ASEAN COVID-19 Response Fund. In terms of institution, we are also, working closely with the member state to finalize the consultation on the establishment of the ASEAN Center for Public Health Emergencies, an equivalent, of the Center for Disease Control and Prevention. So we are hoping, with all of this mechanism and institution, we will be, better prepared and more resilient when it comes to handling the next crisis. Now, we're talking about the recovery process. Let me, kind of look at how we are going to recover from this pandemic from 5 different angles. The first one, of course, I think we need to further strengthen our protection systems. We can see very clearly, when the pandemic hits us, the impacts on our peoples, are not that, even. We can see different proportion of the population, different groups of people, facing different impact, from this COVID-19. And now we are discussing a lot about how we can, further improve our social protection systems, our social welfare, making sure that, this system will work for everyone and not just, for a small numbers of people, especially, the peoples that are vulnerable in times of crisis like this. For the health sector, I mentioned in the beginning, some of the interventions that we are doing, but we are not losing sight of our long-term plans as well. And that is, how we can further expand the universal health coverage. We are now looking at how we are doing, with the universal health coverage. What are the challenges that we encounter? What can we do more to make sure that, this high-quality healthcare access is available to everyone? Another areas that I also want, to also highlight is that some of the problem, for example, when it comes to care and also the health access, for people who are not, patients infected by COVID-19, we also face these problems as well because of the overwhelming cases in some of our member states, and we don't have enough care and enough support for these people. For example, the elderlies and also people who suffer from other diseases and so on. So this is some things that I think we need to look at in terms of our future plan on how we can prepare the region well when it comes to on the one hand taking care of the people who are infected by COVID-19, but on the other hand, the people who still require primary healthcare support and also attentions for other forms of diseases. Another issues that we also working very closely with member state and also partners is in times of crisis like this. Of course, we are preoccupied with responding to the pandemic, but at the same time, it's important for us to not forget about those who might, suffer silently because of the pandemic. For example, our children, women and girls, and a person with disabilities. So I think this is some things that we keep emphasizing. Actually, we've been discussing this at the high levels as well. The impact of COVID-19 that also lead to some sort of violence, abuse, exploitations, and in some cases because of the economic burdens rising from the COVID-19. There's also these issues of early child marriage and so on. So this is part of our protection bracket. Some things that we want to further strengthen, both now and also after the COVID-19. The second area I want to emphasize, ASEAN can only recover if our people, our community can recover. So it is important for us to support our people so that they can recover well from this pandemic. They can emerge stronger from this pandemic. For this particular area, we are looking at how we can make sure that, the kind of skills that we provide our people are relevant. I think we are now experiencing things, not just double disruption or even triple disruption, the fourth industrial revolution and now the pandemic, but we're also facing the problems of climate change. So it's important, when it comes to the kind of skills that we are going to provide our people, it is also relevant, for the kind of, job of tomorrow. But while we are promoting, 21st century skills, we are also, taking care of the soft skills as well. For example, emotional intelligence, critical thinking, problem solving, some of the skills that enable our people to adapt, to learn, and also to change quickly so that they can strive in this rapid changing world. Another elements of this that I would like also to emphasize is that we need to get the basic right as well. We need to double down on what works. Of course, we are now promoting these high-end skills, but we shouldn't forget that the basic that our people need in order for them to really benefit from the fourth industrial revolution is also important. And here we are talking about lifelong learning. We are talking about early childhood education. We're talking about modern curricula that tailor in a ways that meets the needs of our students, of our young people, and also the qualities of our educator. And our educators not just know about the subject matter they need to teach the student, but also well versed in terms of digital literacies and other skills that are more relevant to the future of work as well. Providing education is important, but then it's also important that we need to make sure that the quality healthcare is there, so that they are healthy, they are capable, so that they can continue to strive in the kind of career they want to take. Of course, when we're talking about the rapid changes in the ways that we deliver education to our people, by leveraging on the digitalizations. One of the problems that we encounter, this is some things that requires our attention both in the short terms and also the long term, which is inclusive digitalization. According to one survey, only 53% of our people have access to internet. So another 50% or so, do not have that luxury, to have access to internet. But then internet is only one thing. We are also talking about devices. We are talking about quality education content, because it's not just about adopting the technology, but incorporate these technologies in a ways that improve access and also quality education. It is also some things that is very, very important. And again, now many of our young people can no longer work because of the pandemic. They are unemployed. So it's important that the governments invest enough to make sure that we can reskill them, upskill them, or allow them to transition from one job to another, and that requires a lot of investment. This is some things that we keep emphasizing when the government put in place the stimulus. So we just want to make sure that the stimulus will work for everyone. Everyone will benefit from the government interventions in this in the response to COVID-19. The third area I want to also highlight, which is relevant to the themes of this discussion this afternoon, which is environmental sustainability. One things we know, the linkages between pandemic, natural disasters, and environmental sustainability. This is some things that keeps coming back to us. And I have to say is that although there's a strong commitment at the high level and so on, but when it comes to the actual implementation, I think it's still a long way for us to go. And because of this reason, we are now finalizing the State of Climate Change report. And in this report, there are two components. The first one is the baseline study, and that looks at how much we achieved so far. And the second component of the State of Climate Change report is to look at the commitment from the member state to make sure that we really deliver what we are supposed to do, and also to meet our obligation as a state the party to the international treaties and so on. And it's not just about addressing the issues of climate change. We're also working on the biodiversity conservations, and one of the issue that is still around, and we're having a lot of discussions on it. But I think now with this pandemic, we should be bold and decisive, and that is the issues of wildlife trade. Of course, member state, some of the member state are now introducing some form of policies and regulation to make sure that this trade is not out of control. But then it requires more comprehensive solution to these issues, and I think it's about time for us to do something about this. Also related to environmental sustainability, we look at the economic growth model in the region is also changing. Now the member states start talking about greening the economies. So you're seeing a numbers of key documents coming out this year and also last year. For example, declaration on green job, and now we are finalizing the roadmap in order to achieve the commitment that we put in the declarations. And that also related to the future of work that I just mentioned earlier, the kind of skills that we need to equip our young people so that they can take advantage of this new development. Circular economy is also some things that are very interesting to the member state, and there's a lot of major initiative, and there's strong support from partners as well. So this is also the areas that we will be looking going forward. Even now, we are also talking about the decarbonizations, and all of this are part of the bigger agenda that we are now, talking about. And that's also reflected in our comprehensive recovery framework as well. If you look at it, I know that it's not yet out there, and all the details that you cannot find yet, but you can see that it's one of the 5 priority areas, under the comprehensive recovery framework that we put forward. But of course, given the time that we have, I don't think that it's going to be as comprehensive as we want. So it's a living document. We continue to improve it along the way, and platform like this we allow us, to listen to some of the best, practices and good policies that we can further, improve the recovery framework. The fourth areas that I want to also discuss about is, it's about time for us to invest more in building resilience in the region. And this is not just about disaster, but also, the livelihood of our people, the ability to cope and adapt to, different sort of shock. And pandemic is also one of them. We are, at least in the disaster sector, we are now looking at, to invest more in preparedness and mitigations and all that. But then I think it requires more than just this particular area, and especially when it comes to how we can, support our people in times of crisis like this. Capacity building program, the strengthening of the public institutions and so on are also on the way, so that they can do a proper planning. We're also, trying to push hard on the, risk communications, and also, the early warning system. And this early warning system is not just for disaster, but also, other social problems that we're encountering as well. Of course, disaster or pandemics are major shock, but our people are also facing different sort of shocks as well. For example, drought, for example, economic downturns and all that. So I think it's important for us to invest more in the system that support our people in a ways that they can adapt to, they can cope with, different kinds of shock, and be able to emerge, from the crisis as quickly as possible. The last point that I want to highlight is, the recovery process must be inclusive and people-centered. We've been talking about this, for many, many years, and I'm glad that, in the coming weeks, we are going to, launch our ASEAN Development Outlook. And one of the angle that we look at, our development trajectory is, from the inclusive perspective. And I'm glad, one of the key writer of this report is also here with us, Dr. Shaila. I'm sure she's going to elaborate further on this particular study. But we are very serious about this. It's not just about, universal access to infrastructure and facility. I think we need to go beyond access, to also look at qualities, to also look at, how we can engage people in policies and decision-making process as well. I think because we don't have enough time. I mean, the recovery framework, we're trying to put things together as quickly as possible. But I think the best scenario for us going forward is to engage, civil societies, people from outside the government to have a say, to express their views on how, we can further improve the recovery framework. So, it will, reflects the inclusiveness here, and people will have, an ownership, a stake in this plan, and then we can, make sure that when it comes to implementation of the recovery framework, everyone will benefit from it, and everyone will find that there's some things that they can also, contribute to this process. I will end my interventions here, and more than happy, to discuss further later on if there's anything on, the key issues that I just mentioned. And I'm also, looking forward to hearing, idea from our colleagues, in the panel discussions later as well. Thank you, Sita. Back to you.
Thank you very much, DSG, for your keynote address. I think from the intervention of DSG Club, I think we have learned, of course, about the complexities, but also the opportunities brought about by us thinking about how we can recover from the COVID-19 pandemics. Of course, this is not only the health responses, and the recovery will focus on the people of ASEAN, including the vulnerable groups, so that we can ensure the inclusive process, but also the inclusive outcomes for ASEAN. I will recap all the points by the speakers later towards the end. So without further ado, I would like to invite the next speaker. So each speaker will have around 10 to 15 minutes to present, and then we will go into the Q&A as well as the recap session. So please allow me to politely remind you if you are about to go over time. So the next speaker is Mr. Suryon Tangkichanukit, Senior Advisor from the National Economic and Social Development Council, or NESDC Thailand, as well as he's also a representative from the Regional Innovation Center. Mr. Suryon will speak about inclusive innovation for sustainable development. Mr. Suryon, please, you may have the floor. Thank you so much.
Okay. Thank you, Sita. Good afternoon, everyone. In the names of representative from Thailand, I would like to share our experience about how we are going to cope with the post-COVID situation, and also some experiences on the present efforts that we are coping with the situation. I think, as you may realize, we are facing the world with the COVID-19 that not only put us in the global health crisis, but also affects every aspect of the way we live. And I think from our perspective, we scan the horizon in the future. Somehow we come up with some estimate of 18 new normal, some words mentioning here. Yeah. I think for us at present and in the near future, healthcare is social practice that everyone is going to need to adapt. Now, as you can see, everyone is wearing masks. Every shop here, even in any country that facing the COVID crisis, they have a COVID protection facility in the shop, in the service. Activities, either in public or private sector, now must take into account how to protect citizens, how to protect their clients from COVID impacts. Thai economy and Thai society is transforming very fast. We are going to be a cashless society much sooner than we as expected. Now, taxi driver, street vendors, all of us can use a smartphone to do the transaction with cashless. Okay. And the production process in the industrial sector, in business sector, they also need to digitize their process. They need to mechanize their process, automatize their process in order to reduce the using manpower labors. Okay. Essentially, we foresee that the crisis that we are facing may impact different people, different group of people differently. But the final impact would be that the wider disparity between social groups, and this concern every policy makers in the government. So we come up with some kind of a recovery framework. We aim at the national strategy target trying to be as a developed country in the next 15, 20 years, and also answer to the sustainable development goal. So we think that this may be this crisis. As the preacher said, we try to turn this crisis into some kind of opportunity that we can transform our economy, transform our society, and also transform our cultural aspects. Two-pronged strategy that the government has initiated. The first one is about about finding the innovative projects to accelerate the social, economic, and cultural transformation of Thailand. Okay. The second strategy is trying to reform our public policy process that we think we understood that it is an obstacle for our development for some years already. Okay. The focus area that we would like to allocate our resource and pay more attention is about to recover our local economy, to prepare for the future growth, and to enhance our human capital in critical areas that fit the new normal in the future. Okay. I can give you some example of our innovative projects that we are trying to encourage the socio-economic cultural transformation, especially for local economy. For example, we have a project, we approved the project on gastronomy tourism in the northern province, especially Chiang Mai. We provide facilities, provide fund for farming new model based on nutrient agriculture and the sufficiency economy philosophy. We finance one sub-district, one university project in order to utilize researchers and knowledge power of university, allow the country to enhance the productivity of local business, local farming. Okay. And also we initiate new business model to provide soil and fertilizer service for the community level, allow the country. As for the innovative project for us to prepare for future growth based on the BCG model, we also we also have oleochemical projects to prepare to increase value in palm oil-based products. We have smart farming and precision farming big projects. We also setting up some kind of innovation center for industrial use microorganism. We have make a farm project to leverage the economy of scale of farming in Thailand. We have initiated the production for insect protein from insect for animal feeds, and we also trying to restructure production and process of farming in the country by mechanization of every cooperatives in Thailand. Okay. The other packages that we used to try to recover from the crisis is stimulating demand. We have packages like we travel together, a half pay program for government pay half and tourists pay half. We have shop and pay back program that if you shop, you can deduct the tax at the end of the year, something like this. And also we're trying to enhance efficiency of the accessibility to this program to monitor the effectiveness of our policy. We have online survey conducted by NESDC, something like that. Okay. We have a tracking system for the COVID pandemic in every spot of the shop. Something. Finally, we think that this is the best opportunity to transform the public policy process in Thailand. We call it Thailand Policy Lab under the cooperation between UNDP and NESDC in the name of RIC. Okay, this essentially is trying to create a new model for public policy making. We would like to use the new tools like social listening, strategic foresight, design thinking, some kind of precise sandbox, in order to provide new perspective, provide innovative policy for the policy makers in Thailand. And no matter what we are facing for today's new normal or future next normal, we come to the conclusion that we need to reimagine the way we generate public policy in order to make our society more inclusive with the innovative policy. Thank you.
Thank you very much, Kun Surion, for your presentation. I think we have learned a lot from the intervention of NESDC. I think the presentation has also anchored the points raised earlier by DSG Kungpuat by presenting us, of course, with the 18 new normal. I think that's also new for me. I thought new normal is new normal, but now we know with the chart that it's the 18 new normal that will lead us to the next normal. The very concrete examples of projects, especially for technology for all, as well as with the objective of socio-economic cultural transformation was also presented for us to reimagine together how the next or the new way of making policy in the post-COVID-19 world will look like. So thank you very much for your intervention. So now I would like to invite the next speaker, Mr. Giuseppe Bussini, Minister Councillor and Deputy Head of Mission Delegation of the EU to Thailand, to take the floor. The presentation will be on social recovery plan for post-COVID-19 with the emphasis on the priorities from the European Union's perspective. You may have the floor. Thank you very much.
Thank you very much, Sita. I hope everybody can hear me. I'm very glad to be here, even though we are all behind the screen, and I would have preferred to be there with friends and colleagues, but this is the new normal, so there's not much we can do for the time being. I'm very glad to be here because I think it's useful to give at least a few hints about the European Union's response to the COVID-19 crisis. I must say it's a bit of a daunting task for me to try and concentrate everything in about 10 minutes, but I promise I'll do my best. And if I'm too long, I would kindly ask the chair to signal that to me. I have this presentation. We can go to the next slide, please. I have this presentation. Yeah, I would like to start from this. The European Union's motto has always been united in diversity. But I really would like to quote the President of the European Commission, Ms. Ursula von der Leyen, saying that now it's also united in adversity, because cooperation and solidarity among EU member states is really key, and this has always been one of the principles on which the European Union has been built. Next, please. There are a few principles that have been deployed so far to try and counter this unprecedented crisis. Protecting communities from economic impact, helping people to be safe and responsible, funding research for vaccines and treatments, coordinating emergency resources to fight the virus, and even more importantly, since I mean I'm here in Thailand and the European Union has very solid relations with the rest of the world, also offering help to EU neighbors and communities, because the European Union has always stressed that this is a crisis that affects everybody, and we will not be out of this crisis unless everybody is out. Next, please. So on this, building on these principles, the European Union has given its response to the current crisis along four main lines: health and emergency response, economic response, research and funding, and coordinated exit. Next, please. Talking about the health and emergency response, we have here a few examples of what has been done so far. Next, please. I'll try to go as quickly as possible. We have, as European Union, we have supported the healthcare systems of EU countries. We have also joined forces using both EU and national budgets to maximize purchasing clout and secure necessary medical supplies. We also have relied more than ever on the experts' advice in very close cooperation with an agency of the European Union, the European Centre for Disease Prevention and Control, which is located in Stockholm. Next, please. This is something very important. Our response to coronavirus has always been very much focused on European citizens, getting people home. This is something that has kept us busy here in Thailand in the last months. We have organized very many repatriation flights funded by the EU budget for 75%. So we have also secured the so-called green lanes, because even though in some cases movements of European citizens have been limited during this crisis, we wanted to make sure that goods and things could move across borders, not to interrupt economic activities. We've also been helping cross-border workers to get to work. And we have adjusted rules in a number of different sectors. For instance, I mean, this is a concrete example that we can mention. Air companies were forced to organize the so-called ghost flights in order not to lose their rights at airport. And we have, as European Union, we have put an end to that also because, I mean, it had a bearing on the environmental. It had a very heavy environmental impact. So that is something that has been stopped. Next slide, please. This is a very important pillar of our response to the coronavirus crisis, the economic response. And this is really something unprecedented. We have tried, and I would say also managed, to repair the economic and social damage brought by the coronavirus pandemic, helping to kickstart European recovery and protecting and creating jobs. So we have either mobilized or launched a very wide array of new financial and economic instruments. Maybe I can say a few words about some of them without going too much into the details, but you can see that the financial magnitude of the European Union's effort so far has been really unprecedented, just like the current crisis. We can go to the next slide, please. these are the main principles that have animated so far the EU economic response to the COVID-19 crisis. First of all, of course, keep the economy going, try to do our best to avoid major damage to the economy, supporting workers and business, and I think this is particularly relevant to the theme of this session. We have tried to make sure that the financial and economic consequences of the COVID-19 crisis do not affect, for instance, workers and families more than necessary. We have also made a major effort to adapting the European Union funding to the crisis, and this has been in conjunction with the current discussions for the next 7-year budget of the European Union. Finally, last but not least, I should say, the European Union has really mobilized all available resources to make sure that all these went into the direction of a strengthened response, economic and social response to the COVID-19 crisis. Next slide, please. Next, please. So these are the main strands of the recovery, so-called recovery plan for Europe. You can see on the right, the financial magnitude is really impressive. It's altogether more than 1 trillion euros, combined between different lines, different instruments that we have mobilized for fighting the COVID-19 crisis and its consequences. Next, please. We can go to the next one, please, because I would like to also focus on the quality of the recovery, because this has already been mentioned by the previous speakers, and I very much agree with them. This crisis almost paradoxically gives us also an opportunity to build back better. So one element on which the European Union is being really adamant is on the necessity of rebuilding following the principles of the so-called European Green Deal. We must make sure that the recovery, the future growth, everything goes into this direction, building a more sustainable economic and social system. Next, please. Talking about quality of the recovery, there's also this, which is another important pillar of our recovery strategy. For instance, the digital transformation. We must also make sure that our systems become stronger in terms of connectivity, and we can mention here the 5G and broadband, for instance, data economy, technology, fair business, and also a very important element is the strengthening of the skills agenda for Europe and cybersecurity. Next, please. Another important pillar is research. You know that the European Union is among the main supporters, financial supporters of research programs in the world. And scientific research, it goes without saying, that is a very important element of the recovery. We have to fight something, a virus, and we must fight it with the means and the knowledge put at our disposal by scientific research. And in this context, I would like to recall a very important pledging event that was organized by the European Union in May, and that continued until the end of June, which was the coronavirus global response pledging event, which allowed to put together something like 15 billion euros for the research against the coronavirus. Next slide, please. here is what I was saying. It's actually almost 16 billion euros collected so far, and much of this will go, for instance, into the supporting fair and universal access to vaccines. This is something that is very close to the European Union's heart. We want everybody be put in a position to have access to vaccines, because we cannot allow only partial solutions to the coronavirus crisis. Next, please. This is the fourth and last point that I wanted to mention, coordinated exit strategy. I must say that this presentation was drafted 2-3 weeks ago. And quite unfortunately, the news that are in the press and you can access these days give us slightly different picture, because the European Union is in a quite problematic situation right now. There's a second wave which is hitting very hard, especially some of the European member states. So the exit strategy is looks a bit optimistic at this very moment. But I would like to mention the main elements of this coordinated exit strategy. When the situation improves, confinement and also kind of the measures aimed at limiting movements of European citizens must be phased out in a coordinated way, because you know that most of European countries belong to the so-called Schengen areas. So there's a free movement of circulation of European citizens across the European territory. So this calls evidently for a coordinated response by the EU member states, using some common principles and some common data provided by scientific evidence, and also by also on the basis of a wide use of technological means, among which, for instance, tracing apps. Next, please. So this is is about travel and tourism in 2020 and beyond. It's clear that the European Union is eager to see freedom of movement and circulation reestablished across the EU territory. This might be a bit too early for the time being. Next, please. So this brings me to the end of my presentation. I've given you a kind of few elements of the European response to the coronavirus crisis, the financial and magnitude of our effort, and also the principles on which it is based. First and foremost, I would like to go back to the beginning of my presentation, this concept expressed by the President of the European Commission, that the European Union is united in diversity, but is also very much united in adversity. Thanks a lot. I hope I stayed within my 10 minutes. And I will be more than happy to respond to possible answers and comments in the Q&A session. Thanks a lot.
Thank you very much, Mr. Giuseppe, for your presentation. I think the presentation really started with words that provoked further thinking from our end, especially on united in diversity, but also united in adversity. I think from the recovery plan of Europe, and ASEAN can also learn from the recovery plan of Europe that we'll be more green, we'll be more digitally inclusive and stronger, and of course, we'll be more agile. And all this will be backed up by the investment in research and research funding. Of course, there are similarities between the plan for ASEAN and the plan for Europe. So we hope that we will be able to exchange more in the Q&A session. So without further ado, I would like to invite the next speaker, Dr. Shailaja Fennell from University of Cambridge. Dr. Shaila has been working with us, leading the development of the ASEAN Development Outlook, and also the outlook and its analysis itself also touch upon the impacts of COVID-19 on the development trajectory of ASEAN. So her presentation will focus on inclusive and sustainable development and the COVID-19 pandemic in ASEAN. So Dr. Shaila, you may have the floor. Thank you very much.
Thank you so much, Sita. It's a pleasure to be here, and I would be very happy to make my presentation. It's very helpful to come on the back of two really excellent presentations and the excellent statements of the DSG. So if we look at the snapshot of the last 6 to 8 months, as COVID has hit many countries within the ASEAN region, what is interesting is, as a region, there is considerable diversity in relation to the incidence of cases. It might be thought that this is to do with the income levels of these countries, or it might to do with other features. The main point of my presentation is to emphasize the importance of the social, cultural, and economic intersections in understanding both the effect that the disease has had on countries, but also across the region, what can be learnt. So the previous speaker's comments on the EU were very pertinent for us to provide a contrast. So starting with the point that it might be indeed the case that what has happened in terms of the incidence has to do with income. And I'm very grateful to the team that has worked with me on the ASEAN Development Report because we brought together over 50 experts and they have provided us great insights. So one of our colleagues, Professor Anand, did a piece on COVID for us, and he was able to show that actually, if we look at the HDI, the Human Development Index, a major way of looking at the human benefits in society, it would not appear that the HDI, which brings together income, education, and health, these formal features have had a huge impact, because otherwise you would expect countries to be impacted differently. And so what I'm trying to say is that we need to unpick this. So if you look at Singapore out here, it has a very high HDI, but it also had a very high level of cases. It might be, and this goes beyond the current presentation, but as the DSG said, we need to do more work in this area to try and understand why. And so what we're looking at here is to try and bring in, as I said, the social and cultural, because human beings live together in communities. And this is also the way they experience the pandemic. So in the first instance, you can say the incidence of the pandemic is on the behavior of individuals. And while that is true, their individual behavior is only part of the story. So in the UK, for example, where I'm located, we say, oh, young people are going out and that is the cause. Or we can say in India, where I work, migrants are going home, they're bringing the disease. There are all these fears at the individual level. And so the individual may not be the best or the only level at which we should be engaging with the pandemic. And so the point about community is that we work with each other. So even where you have bubbles or community containment or lockdown, we are seeing the benefit of working at the local community level and not with the individual alone. I would also like to bring to our attention, and we've seen this in individual countries in ASEAN region which have done better, there is a need to understand not just the community, but where that community is located. Is it in the rural or the urban? What is that community doing? Are the young people going to school, or people going to work, or are people being entertained? And again, as the previous speaker said, there needs to be a coordinated response, because individual countries seem to be having different rules, which is not very helpful in terms of public information. We also, of course, do need to recognize, as the DSG said, that there is a context of both the technology being available as well as the price of many of the features, including the test itself. If the test and the vaccine are not free, this is going to have effects going forward. So I would recommend going forward, we need to look at these. Now, what I'd like to do in the rest of my presentation and look at the current evidence on why the social and cultural are critical. Sorry, that's For some reason that's frozen. That shouldn't have happened. Okay, so here's the global picture, and this comes. Sorry, hello. Not sure what happened there. Let me. I'm extremely sorry. That shouldn't have happened. Let me just.
Dr. Shaila, we have your presentation. Would you like us to try?
No, I'll just go through it. Thank you.
Okay,
if I
right.
can. Yeah, sorry, that was a glitch. So if I can look at this particular slide, and this came out of the UN Secretary's policy statement, which was so effective in May. And if we look at the particular impact, and the first aspect of vulnerability I want to look at is food. And you might say there are very few in the ASEAN region, but there are countries, for example, Myanmar has been affected hugely by this. And so we need to think about food insecurity as one of the features. And I said in my previous slide, the rural-urban could also be part of this. If one looks at how this plays out in terms of some of the best practice that we have at the moment, we do understand that the health system cannot be accessed, or health interventions cannot be understood without looking at food and nutrition and social protection. So these are intersecting spheres. And it is clear that in countries in the ASEAN region which have done better, there's been an attempt to actually engage with all of these. So I do understand that, you know, there's a question of dollars and cents, and we have to try and examine whether this should be about formal outlay. And it is, of course, helpful to have more funds. And there is a difference in countries across ASEAN about having the level of health expenditure. But I would like to, again, in relation to my point about human development and the incidence, and as I said, countries like Singapore or Malaysia might be getting more impact because of the health transmission due to globalization, more people coming from other countries. So we need to be careful about where we put our emphasis and therefore our priority. And so I would like to look at the situation in countries in the ASEAN region, which might give us more detail of how we can bring those spheres together, how we can ensure that the health, social protection, and the aspect of food can actually help people, particularly in terms of their nutrition and their vulnerability, at a time where trade corridors are difficult and it is not possible to have as many green lanes as we would like, as the EU representative mentioned. So I'd like to look at what happened in May. By the time May occurred, there would be lockdowns, and it might be possible to learn from neighbors. So one of the things that ASEAN did well was to allow migrants to move back home. But of course, when they come home, if the trade corridor is not open, food is still a challenge in countries. Furthermore, as we all now know, unfortunately, but I think it has come to stay, this is not a pandemic that's a one-off, and we will all go into a second phase, and we will learn, hopefully, as a global community to manage this disease. And so looking forward, it is really important to both ensure local delivery stocks work, particularly where wholesale markets don't work. And often we look for the national and then the subnational to deliver locally. I'm asking us to think of bottom-up solutions. I say this because we have evidence that this might work, particularly the case of Vietnam, which has been often, and we hope very much to study this further as a best practice in relation to what happened across the flattening of the curve. It would appear that public health campaigns that didn't simply say the disease was a problem, but also showed people how they could eat better. So the public campaigns were very much about eat better, particularly because if you're in lockdown, you will not be able to exercise. UNICEF has done some excellent work across the region and shown why Vietnam has best practice. And I was particularly struck by two features in this. It did not just give a national level message. It focused that particularity of the lack of fresh food, telling people where they could look, you know, how they could grow, how they could think of better diets, almost making it an exercise of engagement, saying, look, these are the recipes that you can use to have a better diet. And they also focused, of course, on the more risk populations, people, children, expectant mothers. But for the general population, the tendency for all countries in lockdown is to go for junk food because it's more easily accessible, focusing particularly on health at a time of crisis. The third aspect of managing the behavioral change, which is the intersection between humans in their health, food, and social protection regime, trying to manage them as multidimensional features, is to think about why communities break rules, and not just to have, again, one size fits all approach and be punitive. And we know particularly vulnerable peri-urban communities where there isn't anything but the daily wage have to do a very difficult trade-off. Do I go out and get sick but get work, or do I stay at home? I provide this detail because it's in this detail that we see the difference between communities. And as I said, going back to my first point on this slide, particularly when national food chains are in difficulty, this ability to manage trade-offs and allow people to stay home with better social messaging, but also targeting of deliveries of food and critical medical resources is important. And so I come to my last two slides about how this is possible. You could say, well, you said public information, but the internet is so varied. And this is why I am looking at bottom-up solutions and old-fashioned systems of broadcasting like local radio systems, or even the local primary health center with leaflets. These need to be complementary to the internet provision because more than anything else, while we recognize the value of technology, it is clear that it is unequally available across the ASEAN region. And so it is really important to then see it is Vietnam without the highest level of internet that's done well, but maybe these can be transferred to other countries and we can learn from neighbors. So my final slide is, what are these lessons from neighbors? And as I said, the UNICEF's ability to pull together these features is really important. It shows that going forward, one of the gaps we have at the moment, because this has been a crisis of a type we have not seen since the Spanish flu globally, the evidence base has to be collected. And I would suggest it's through this good practice where there is the knowledge that communities can help, that we might get the social impacts assessed at the same time as we collect data on health. This would allow that overlay of the circles I talked about between health, food, and social protection, so we know where to target. So we don't go, oh, it's the richest, oh, it's the poorest. We try and be more intelligent design in where the targeting occurs. And the third sphere itself, social protection, what kind of social protection? In addition to food, it's also susceptibility to disease. So if someone lives in an area which is much more likely to get regularly reinfected, for example, health workers, they may not be the poorest, but they need to be focused on as well. So this data will give us a smart response to understanding vulnerability and how to withstand shocks. And this, I think, will become the first stage of something the WHO, the FAO, IFAD, WFP across the world, but particularly for the ASEAN region, which is showing some good practice, can become a global showcase for looking out health and food systems might work together. And I was particularly pleased to see not only the idea of physical health and nutrition, but within that, the focusing on micronutrients, so going forward in terms of sustainable health, and also the links that are beginning to become evident by the loss of jobs, which is a trigger for people going out and looking and reinfecting themselves and others, and mental health. So we will be doing more than just managing COVID. We'll be managing the health system going forward in a much more effective way. Thank you very much, and apologies for the glitch in the middle. Thank you, Dr. Sita.
Thank you very much, Dr. Shaila, for your presentation. I think, again, it's illuminating for us to look at the COVID-19 in ASEAN employing the human development lens. I think from the presentation of Cambridge, it's clear why socio-cultural aspects are important to the COVID-19 from the lens of behavioral change and the intervention at the individual and community level. And I think Dr. Shaila has emphasized a very important point on the bottom-up solutions and delineate through the delineation of different aspects of human development in the context of COVID-19, the health, the food, the different aspects of jobs and social protection. So thank you very much for your presentation. So we will move to the next presenter. Of course, again, our friend and very familiar face working together with ASEAN. So I would like to invite Dr. Mary Lisa Decane, the president of the Institute for Social Entrepreneurship in Asia. So her presentation, as you see on the screen, will focus on social enterprises as innovators toward building back fairer, and that is the keyword, fairer amid COVID-19. So Dr. Mary, you may have the floor. Thank you very much.
Thank you very much, Dr. Sita. Good afternoon, everyone. And my topic directly addresses the concern articulated by the DSG about people-centered recovery and Dr. Fennell's call for bottom-up solutions. No? So you may be asking, some of you who are not familiar with social enterprises, what are they? Well, they are actually hybrid organizations. And sometimes they are seen as social mission-driven businesses, but sometimes they're also seen as the trading segment of the civil society sector. They're sometimes micro, small, medium, and large, and they come in various legal forms from cooperatives, associations, foundations, stock for-profit corporations, and limited companies, non-stock, non-profit corporations, and partnerships, as well as single proprietorships. So let me just go to my next slide, please. So just before the pandemic, social enterprises were being seen by the UN system, UNSCAP, as actually accelerators of the SDGs. Before COVID-19 happened, we were about to co-convene and launch, as well as develop social entrepreneurship SDG acceleration platforms. And this was in recognition of the important contribution of social enterprises and the potential that social enterprise multi-stakeholder platforms can have as game changers for the SDGs, especially in addressing SDGs that were actually retrogressing, such as the SDG on equality. Next slide, please. But of course, COVID-19 happened, and what COVID-19 did was to actually introduce, of course, setbacks with the social enterprise sector. And in the Philippines, where we did a social enterprise survey, we found that 96% of social enterprises experienced some to a major downturn. And in terms of sales and revenues, about 1/3 of them declined their sales by 100%. No? Of course, the others declined in different ways in various levels. No? But the effect of COVID-19 on social enterprises, next slide, please, was actually differentiated. And the reason why it was differentiated was because of certain internal and external factors. Some internal factors, for example, include the level of social enterprise maturity and sustainability, including the diversity of income sources and extent of digital and ICT integration prior to COVID-19. Also internal factors such as the nature and extent of partnership and relations with resource institutions and governments, as well as the level of leadership and organizational agility and entrepreneurial management competencies, including the capacity for managing change and innovation. These were some of the internal factors that actually impacted on a differentiated impact, no? That caused a differentiated impact. And among the external factors that caused a differentiated impact was the nature and the type of the product or service, or the value chain and economic subsector where the social enterprise was situated, so that if you were in ecotourism or you're operating a restaurant or a cafe, no, you were totally devastated. But in other sectors, like for example, farming communities that were producing palay or rice, who sold their rice to local government units for relief, actually were not affected by the pandemic. Another external factor was the nature of the market and the distance from sources of inputs, as well as the location and access to infrastructure support, including digital infrastructure. But I just wanted to show that a number of internal and external factors impacted on the way that social enterprises were affected, and of course, as a result, the poverty sectors that they also serve. No? Next slide, please. So the more vulnerable social enterprises have closed or stopped operations, but those, and there are a big number that have become sustainers, even as they were affected by the pandemic, have adopted measures and mechanisms to immediately respond to their drastically changed situation. They are rebuilding and pursuing innovations towards recovery, and they're reconfiguring their social enterprise models or pursuing their pre-pandemic social enterprise models that have been proven more relevant now. No? And common to all the social enterprises that sustain their operations is their strong commitment to put the needs of poverty sectors first, the best way they can. And just to show you the breadth and scope of social enterprise initiatives in response to the pandemic in Southeast Asia, we did, next slide please. We did a webinar series where we featured 10 social enterprise responses across Asia. And those in Southeast Asia, for example, included fair trade enterprises that were actually producing, who transformed their craft communities to become producers of personal protective equipment, such as face masks, including eco-friendly face masks. In Indonesia, for example, Dompet Duafa has a community-based health has a community-based health program, and their hospitals for the poor actually were in the forefront of serving COVID-19 cases among the poor. In Vietnam, Center for Social Initiatives Promotion was in the forefront of providing services to the social enterprise sector, and they showed a model for digital transformation amid COVID-19. No? And in Thailand, many of those involved in ecotourism and had cafes and restaurants, they actually transformed their models to become community-based delivery systems for food and basic needs, utilizing ICT and social media. And in the Philippines, where there have been empowerment strategies that have effectively assisted small producer communities, they actually demonstrated food secure and resilient communities amidst COVID crisis. No? But that's just to give you a sense of some of the initiatives of social enterprises in response to COVID-19. On the whole, what we've seen among social enterprises, next slide please, is that they've showed inspiring models and responses to the pandemic. They demonstrated values of social equity, sustainability, and solidarity, serving marginalized sectors and communities as well as social entrepreneurs and frontliners. They showed how empowered small producers have achieved food security and resilience. They have showed the pursuit of social innovation and creatively utilized ICT and social media to be more responsive and to enhance their outreach, showing the way towards community-oriented digital economies. And then they mobilize stakeholders and community assets, networks, and cadres in reaching the most vulnerable populations, including very far-flung areas, bridging digital and social divides. And in some cases, they even disrupted markets for the common good. So, social enterprises as a whole during the pandemic, next slide please, had multi-level responses, yeah? And there were individual and bilateral partnerships that were made. There were multilateral partnerships between and among social enterprises and their social enterprise resource institutions. There were also coalitions, such as the Poverty Reduction through Social Entrepreneurship Coalition in the Philippines, that undertook an action research and continued and pursued their advocacy for a poverty reduction through social entrepreneurship law and program that was needed even more so than before. And over and above that, there have been multi-stakeholder platforms that have been initiated by social enterprises towards inclusive recovery and building back fairer at the national and regional level. And through the COVID-19 social enterprise response and visioning effort that ISEA, the Institute for Social Entrepreneurship in Asia, led, next slide please, we were able to actually transform what we're supposed to be, next slide please, social entrepreneurship SDG acceleration, the slide before that please. Social entrepreneurship SDG acceleration platforms that I was talking about that we were going to be launching before the pandemic. We were able to transform them through a process into platforms for inclusive recovery and building back fairer. And I just wanted to introduce you to these 5 platforms. One is Women's Empowerment, Livelihoods, and Food in Agricultural Value Chains, which we call We Live Food platform. Decent Work for All in Sustainable Value Chains. Health for All. rural revitalization, youth and social entrepreneurship, and technological innovations for sustainable development. I will not have the time to discuss all these platforms, but I just wanted to give you a sense of one of our platforms. No, the next slide, please. Our women's empowerment, livelihood and food platform is actually promoting a set of benchmarks for transformational partnerships and women's economic empowerment in agricultural value chains. And we have a very strong engagement with ASEAN, and we have a strong constituency among ASEAN social enterprises. We're also engaging now SMEs as well as corporations to become transformational partners of the poor, as well as to promote women's economic empowerment in agricultural value chains. And the benchmarks for transformational partnerships and women's economic empowerment has 8 elements. It includes appropriate technology and community-based and oriented innovations, the small producers having getting a more substantive share of value created over time by having them move up the value chain. They're strong in relation to food security and resilience, empowerment of small producers, stewardship and sustainable consumption and production, as well as sustainable agriculture, the combination of transactional and transformational services, women's participation and empowerment, and measurable outcomes of transformation. We actually created scorecards of using these 8 elements of success in engaging women and men small-scale producers in Southeast Asia. And the scorecards can actually assist SMEs, social enterprises, corporations, and agricultural value chain players to transform their operations to becoming more transformational partners of small producers and to actually become enablers of women's economic empowerment. And in ASEAN, we also have an ongoing advocacy to actually enshrine a set of guidelines for transformational partnerships and women's economic empowerment in agricultural value chains, which are a set of enabling policies as well as incentives for the practice of the benchmarks for transformational partnerships and women's economic empowerment in agricultural value chains. Next slide, please. So the multi-stakeholder platforms that I mentioned have been launched and presented at a conference that we co-convened with UNSCAP in September 2020, and that's what actually a session where we actually had Dr. Sita there, and the multi-stakeholder platforms are intended to promote the recovery of social enterprises towards leaving no one behind and building back fairer. No? And they're meant to be learning exchange and capacity development platforms. They're meant to project collective impact. They're meant to engage governments for changes in policy and programs, as well as collaborative endeavors. And they're also meant to promote partnerships towards cross-sectoral collaboration. Next slide, please. The Sustainable Development Goals that the stakeholders from the 5 platforms shall be contributing to are the Sustainable Development Goals linked to Pandemic Recovery Plus. We say plus because we're going beyond actually the 9 SDGs that were identified by the UN, including gender equality. No, so these are no poverty, zero hunger, good health and well-being, reduced inequality, decent work and inclusive growth, inclusive and sustainable industrialization and innovation, responsible consumption and production, sustainable communities, climate action, women's empowerment, peace, justice and strong institutions, and partnership for the goals. So I just wanted to share with you. That's my last slide. I just wanted to share with you that social enterprises are a very important partner of governments, the business community, and civil society in the recovery process towards building back fairer. Thank you.
Thank you very much, Dr. Mary, for your presentation. From the presentation, I think we have learn about the critical role of social enterprises, even if they are, as Dr. Mary has presented, experiences. They are experiencing the downturn from their end, but at the same time, they are resilient and their inspiring roles in mitigating the impact of COVID-19, especially on the poverty and marginalized sector, is something that we can learn from. I like the word sustainers, social enterprises as course, helping us through the recovery process. And very importantly, I think the roles of youth and women, especially in the rural areas, in helping us not only responding to, but recovering from the COVID-19 in the context of not going backward in terms of implementation of the SDGs is very pivotal to ASEAN and other regions. So thank you very much for your presentation. So we still have one more important speaker, Mr. Dayan from UNESCAP. So Mr. Dayan is Associate Statistician of UNESCAP, and then he will be presenting on the progress towards the SDGs in Southeast Asia. So Mr. Dayan, you may have the floor. Thank you very much.
Thank you, Dr. Sita. Good afternoon, everyone. I hope you're hearing me. My name is Dayan Shayani. I'm here presenting today as an alternate of Mr. Arman Bidarbaknia, who had a conflicting appointment, so he couldn't make it. We both work in the statistics division of ESCAP, and we have been analyzing SDG data in order to monitor its progress based on evidence. So I'm pleased to present to you today the progress towards the SDG in the Southeast Asia sub-region. We basically tried to answer two questions. Many of you might be already familiar, but I'll give you a bit of an overview of our work. The first question is, how much progress has been made so far? And the second question is, are we going to achieve the targets if we continue with business as usual? So the first question is looking into the past to see what the data tells us about the progress so far. Here we can identify some strengths and some weaknesses. The second question is about looking into the future, identifying the areas that need acceleration. And in the present circumstances, with many economies disrupted by the pandemic, the future has become even more uncertain. But nevertheless, our analysis is kind of a baseline without factoring the impact of the pandemic. The key elements here is, I'll just go very briefly over some methodological notes. The first point is that we use data from the global database and international organizations. These are official SDG data, and all of these data can be accessed on the ESCAP's SDG gateway at data.unescap.org. We don't collect data directly from the countries. And whenever we have disaggregated data, we try to use it as much as possible so that we ensure that no one is left behind. So if we identify certain subgroups, some subpopulations that are faring much worse than the total population, then we take that into account into our calculations. Second, the indicator list is we try to use all the indicators from the global database that have data for the region. So we don't pick and choose the indicators. We try to use all that is available. And finally, when we have to set a target value, some of them, there is a target value explicit in the 2030 agenda, and then we use them. But these are the minority of the indicators. So for most of the other indicators, we have to find a way to create a target value that is both aspirational, but the average growth among the top 5 performers of the region, meaning we look at the countries that have been done the best, and then we try to extrapolate their progress for what could be achieved for the whole region. Here, I'll show you a bit of the situation on the availability of indicators for the SDGs. As you know, the SDGs have been around since 2015, and every country in the world is trying to produce the data and the indicators that were mandated. However, as you can see here, right now, in the best cases, we have about half or a bit more than half of the indicators with sufficient data available for the progress assessment. So this means that we're still looking at the SDGs with kind of like a blurry vision. What we see nowadays is perhaps half of what's going on in terms of the whole framework of the Agenda 2030. This also shows the importance of strengthening the national statistical systems so we can best monitor the SDGs. And that's something that the ESCAP Statistics is working together with partners so that we can try to get all these bars to be green way before 2030. Now, here's the first results that we have. It's basically the first question: how much progress have we made so far? And this is the situation for Southeast Asia. As you can see, it's a mixed picture. We have some goals where a lot of progress has been made, like in Goal 4, quality of education, Goal 9 on industry, innovation, and infrastructure. Here, more or less, we're kind of on track on these goals. However, on most of the other goals, the progress has been very little, very shy, or sometimes even regressing, meaning we're going backwards, like in Goal 10 for reduced inequalities and Goal 16 for peace, justice, and strong institutions. And then again here, as you can see in those strength bars, this is based on very limited data that we have. So as we get more data, as countries produce more indicators, we will be able to see a much clearer vision of where we are now. But this is the status we have nowadays. And for the second question, which is, are we going to achieve those targets? Are we going to achieve those goals? Here we have what we call the dashboard, where we look at each of the targets of the SDGs and try to project them into the future and see if we're going to achieve them or not. Well, this was done based on data before COVID-19. So again, we don't know how things will change now, and we're going in very uncertain times. So what we expect is to see perhaps some of these targets even becoming worse than we thought, while maybe others might actually be doing better. So that's the part we don't know. But if we look at each target, and I'm sure that you cannot really see the details here, and I invite you to access our website later to have a closer look. But I'll show an example of one goal, Goal 3 on health. And here you can see that even within one goal, we have different targets at different levels of achievement. We see the targets on maternal mortality and child mortality actually doing quite well. And we are expecting that if we maintain the same trajectory, we will reach those targets. However, on other targets, the ones in yellow, on communicable diseases, sexual and reproductive health, tobacco control, health financing and workforce, here we see that a big acceleration needs to be done so we can achieve. And finally, on non-communicable diseases, substance abuse, road traffic accidents, these are the ones that actually we're regressing. And so we need to turn around. We need to make even a stronger effort to be on track for this, to be able to achieve those targets. So this analysis is part of ESCAP support to the region and to every member state. I'll just tell you very quickly about what we do and what kind of services we can provide. We can do this kind of analysis at the national level together with the governments. And we provide this methodology and tool for progress assessment. This is something that we can do for every country who is interested in assessing the progress that they've made towards the SDGs and which areas they need to focus and prioritize. A second area that we provide support to countries is on integrating policy with data. And that's the initiative called EPIC, Every Policy is Connected. And this is also something very interesting, which is that we try to bring policymakers together with statisticians in the same room and try to analyze what policies they have and what data they have, and then find the gaps and find the areas in common so that we can strengthen both sides. And finally, we have a full-time SDG regional advisor that can provide services to every country here in Southeast Asia. I'd like to also mention, as my last slide, is that we are now also working on something that is coming very soon, which is an interactive web application that will allow every country to produce this progress assessment at the country level, and they will be able to add their own national targets indicator and data to produce these kind of graphs. So this is something that will become available in December this year, hopefully, and we will be informing all the member states of this new product of ESCAP. That's all I had to say for today. Thank you very much. Back to you, Dr. Sita.
Thank you very much, Mr. Yayan, for your presentation. I think, again, we are reminded that data is very important for us to be able to chart our ways forward to recover from the pandemics. I think ESCAP and their work on data has been very essential to both ASEAN and the member states in looking at the implementation of the SDG, especially I think the SDG 10 and 16 are the areas where we need to work more on. Also from the presentation, the dashboard and the availability of data, again, there has to be more efforts in making sure that the data is available and usable. And most importantly, the presentation of ESCAP highlighted the importance to translate data into analysis and policy making. So we need to strengthen that link as well. So I think we come to the end of the panel discussion. We have time for the Q&A. I understand that ESCAP will also help manage the chat box I also have here. We would like to invite the participants to post questions, and if any particular questions are addressed to specific speakers, please also let us know. Thank you very much. But Ronnie, if I may, please also inform me if there are any questions, because I cannot see everyone on the screen. Thank you so much.
Yes. Also, in addition to posting on the chat box, you can also raise your hands. Okay, I think there's a question from Simon Galimberti. He asked if he could have more information on EPIC for Mr. Dayan.
Okay, but perhaps we can start with the first question just to get the momentum going for the Q&A session. So if Mr. Dayan can answer to elaborate more on the EPIC. We really like these acronyms. Thank you so much.
Thank you. Thank you for the question. So EPIC, I
think you're muted, Dayan.
Sorry, I forgot to unmute myself. So thank you for the question. EPIC is an initiative that ESCAP started about 2 years ago that aims at really marrying together policymakers with statisticians in the sense that we bring them to the same table and we analyze together the indicator frameworks and the policies to find out where are the gaps that exist in each one of them. It's a very, involving process that takes the participants in a journey where they start from the policy and they break down the policy into smaller issues and smaller parts, and then try to address which kind of subject matters that are involved in each one of the topics of the policy. And then we look at the indicator frameworks that are available at the national level, at the regional level, at the global level. And then the participants then try to find matches among them to see what kind of areas there are already indicators available and data is available, and what actually is being said in the policy document, but they are not being monitored by any indicator. And also vice versa, some areas where there is already indicators and data available, but they are not being addressed in the policies as well. So this is an exercise that we work together with countries either at the sectorial level or at the national planning level, to be able to bring statistics and policy making closer together. And we're very happy to elaborate more on bilateral meetings if needed.
Thank you very much for your answer. I don't see any additional questions in the chat box. Okay. There is one question, again, I think on the data. Given that data availability is a serious problem in the region, how's ESCAP's strategy to improve data availability? So perhaps I can invite Diane to answer again, and if any other speakers would like to make additional point on data, then please let us know. Thank you so much.
Yes, thank you for this question as well. In terms of data availability, there are many reasons why data is not available. Sometimes is a lack of investment at the country level. Sometimes is lack of skills and lack of knowledge of how to compile the SDG indicators. And in those cases, what ESCAP is doing is that we have been developing courses and workshops for national statistical offices in order to address those skill gap and knowledge gaps. In terms of financing, also ESCAP is working at the global level as well to attract investment and assistance to countries in the region. We know there are many countries here in Southeast Asia that are right now working together with ESCAP and with other partners exactly for that, to help increase the availability of their SDG indicators.
Thank you very much for your answer. I'm looking at my phone, not because I am chatting, but the team at the ASEAN Secretariat also alerts me that Dr. Shaila would like to make intervention. So please.
Thank you. Thank you so much. I raised my hand, but maybe you couldn't see it. So I'd like to add to the point made by Diane. I would also like to suggest, given, of course, that we are a university, I think engaging with university departments in terms of thinking of surveys, it's one of the things that we have suggested in the ASEAN Development Outlook. I entirely agree with you, Diane, that it's important to increase the database. We found in our work as well that we are constrained, but I would suggest, rather than waiting for the formal process, this is an opportunity as countries think about the specific questions they have to work with how one can have innovative surveys that can be used for deep dives into particular areas, so that you have a bottom-up participatory process of data collection that can complement and work with the formal the statistical analysis that is needed. Partly this will give countries the sense that they need this, and there will be a political traction within communities at the level of a district, for example, but also because increasingly the nature of the problems that we have seen, like in the example I gave of social health and food systems engaging with each other, the way we tend to do surveys tends to be in a more traditional world where our conceptualization is somewhat skewed. So I would like to suggest that maybe this excellent program you're saying ESCAP is working with national governments in ASEAN, maybe we can think about ways in which we can bring in the technical skills of the universities and maybe work with a group of master's students to try and take this forward. That would be my suggestion, but I would say that as an academic, wouldn't I? But thank you so much, Diane.
Thank you very much, Dr. Shaila. Also, I think our keynote speaker, DSG Kumpua, would like to make an intervention. So DSG, please, you may have the floor.
Well, thank you very much, Sita, and also, thanks to colleague, for pointing that out. I totally agree with you, when it comes to data, it is one thing that, remains a major challenge for us, when we really want to know, whether we are on track when it comes to our blueprint and also, our plan of action and so on. I'm glad, there's some interest, including SCAP, to work with us. For example, with SCAP, we are planning to do the monitoring and evaluation framework for our enabling master plan, but that's, a good starting point. I like to also share that now at the Secretariat, we are, thinking about how can we further strengthen the ASCC database. But of course, I more than welcome, the comments and input from colleagues and also from Dr. Shailajas as well, on some of the possible methodology, some of the, possible area that we can do. And, at the ASEAN level, we have the Statistic Committee, that is a body responsible for this matter. But at least, for the ASCC, we've been, working with the planning agencies. We've been bringing in, a colleague from the Statistic Bureau and so on to discuss, how we can further improve that. I want to also, emphasize that this year is a very important year for us. We've been doing the midterm review of our blueprint. We also, working on the next work plan. And data is always, a problem for all of the works that we are doing here. So I'm looking forward, to building a comprehensive, a statistic project, at the ASEAN Secretariat, and probably in the coming weeks and months we might organize some sort of meetings. And would be, very happy if your colleague, for example, from SCAP can also attend such a meeting, and then we can think together how can we strengthens our database, how we can strengthen our monitoring and evaluation framework. So this is some things that I would like, to share with colleagues here.
Thank you very much, DSG, for highlighting the need for data and also the ongoing efforts of ASEAN through the midterm review and a number of M&E frameworks for our sector bodies to measure the progress related to sustainable inclusive development. I think there's one more related question from Simone on highlighting that there is a massive lack of data, and how optimistic should we be that we will get more data. So perhaps if I can take the liberty to also invite Dr. Mary perhaps to also take the floor from the perspective of the social enterprises on data, and then other panelists can also join in. Thank you very much. Dr. Mary? Yes.
Yeah. So, well, on the issue of data, sometimes we try to look for disaggregated data across poverty sectors, but I think we do not have enough of that. Because when we talk about targeted approaches to poverty reduction and addressing inequality, I think we need more specific data related to major poverty groups, and maybe providing data in that respect that's gender disaggregated as well will be very useful.
Thank you very much. If any other speakers would like to provide insights on the optimism of getting more data, then please let us know. Diane raised hand, yes. So you may have the floor. Thank you.
Thank you. Just a few more words on the data availability. Very well noted by this participant about Singapore and Brunei. In fact, we observe that more developed countries in the region, they tend to produce less SDG indicators. And this goes to show that sometimes producing data is not just about financing of it, but actually a willingness to produce. And interestingly enough, when you look at data, even from developed countries, and now complementing a bit of the point made by the previous speaker, is that sometimes when we look at the data from developed countries, we also see many blind spots, some areas where situation is not going very well. And in fact, That's why we actually recommend, and we look at all the countries in the region with across all the SDG indicators. Sometimes some indicators might not be doing as well as you think they are, and when you're not collecting data and when you're not compiling indicators, then you just don't know what's going on. So that's why our recommendation is for all the countries to comply with the framework of the SDGs and try the best they can to produce the indicators.
Thank you very much. I also saw Dr. Shaila raise hand. So
thank you so much, Dr. Sita. I think Diane makes an incredibly important point that the value of data is often what generates interest within countries because they want to be seen to do something. And I would suggest that qualitative data of good practice becomes a good entry point. So we select areas where there's good practice, where a country or within region, within ASEAN, there's interest in learning between partners, then that allows for collaboration. And I think Diane's point is excellent. And I think with support of SCAP, this could become a very useful method, particularly as I know within ASEAN, the discussions of 4IR. I think digital technologies could help us in some ways, but I think ensuring that human capital is also available and that we excite our young people, it's a young region, to actually want to be part of a process where data collection is not something that is done very far away with no meaning for their lives, but actually helps them in decision making. So I really strongly support the comments that have been made. I find them extremely hopeful and inspiring. Thank you.
Thank you, Dr. Shaila. I don't see any more questions in the chat box. There is there is in the chat box intervention from Singapore pointing out that the Singapore Department of Statistics had launched SDG webpage in September 2019 to track the progress on SDGs. So this is for the information of the meeting. So if any more questions, perhaps. Okay, I think everyone is very satisfied with a very enriching discussion from the panel discussion. I am also informed that there may be protests soon at 4 p.m. in Bangkok. So I think it's also a good time for us to wrap up for the safety of the people in Bangkok. So now I just would like to do a quick recap that for this panel discussion, of course, from the points raised by DSG as keynote speaker, ASEAN is working on the recovery framework, which we hope will be inclusive both in terms of the process and the outcome. And then there are a number of concrete initiatives that have been put in place. We have also learned from the case of the Regional Innovation Center and Thailand that they are working on not only coping with, but to moving from the new normal to the next normal, especially on the innovation in policy making through learning from projects on the ground. And we also learned from the EU the perspectives on the responses, the recovery, and the vision of going forward, being united in adversity. We have also learned from the academic perspectives, Dr. Shaila, on the importance of employing the human development angle to COVID-19 and the centrality of looking at behavioral change, both at the individual and the community level. And of course, the roles of social enterprises in mitigating the adverse effects of COVID-19 is very important with the strong elements, perhaps that needs the elements that need more boosting on the women's economic empowerment and the empowerment of the youth in the both rural and urban area. Also, the last point, and I think the discussion has been very extensive on the critical roles of data and how we can use data to track our progress on the SDGs, given the detrimental consequences of the COVID-19 on the progress on a number of SDGs in the region. So that's the recap from my end. I will again extend all the thanks to all the panelists here, and I will hand over the floor to Pak Roni. Thank you very much.
Okay, thank you very much, Dr. Sita, and for your kind consideration to allow us to leave earlier this afternoon. So that concludes session 5. We thank His Excellency DSG Kung Phuoc and the ASEAN Secretariat for co-organizing this session. We really do enjoy our partnership. So dear participants, ladies and gentlemen, this concludes our forum for this year. We express our highest appreciation to all key speakers, panelists, and esteemed participants from the Southeast Asian governments, international organizations, UN agencies, academia, and CSOs. The two-day forum has certainly fulfilled our understanding of the challenges and priorities of Southeast Asia region as countries continue to grapple with the effects of the pandemic. We began this forum with an overview of the progress of the SDGs across the Asia-Pacific region and then focused on Southeast Asia. We further delved into the challenges faced by countries as the pandemic affected the implementation of national SDG strategic plans as reported by the government agencies from Brunei Darussalam, Indonesia, Malaysia, Laos, PDR, Thailand, and Malaysia, responsible for ensuring that SDG advancement continues. We also heard from UN agencies who reported that the state of progress in SDG 1, 2, 8, 12, and 16 all have indicated that much work is required in the areas of the implementation as well as its reporting. The issues of bringing in the informal sector, the digital divide, and importance of universal protection were also raised as a priority in a government response. A pandemic recovery is multifaceted, covering health and socio-economic issues. Speakers also highlighted the need for stronger partnerships and stakeholder engagement, especially improving institutional arrangements within governments and involving CSOs in the process. In some countries, there was need for more financial resources, and in all countries, as well as better resource mobilization. More attention is required to address fake news and misinformation and to create a mechanism to really verify misleading biases about COVID-19. The finance sector also plays a significant role in the recovery of the region as evidenced by speakers from Indonesia, Malaysia, and Myanmar, as well as international experts. Therefore, promotion of financial products, awareness, and responsible actions by banks and financial institutions must be encouraged and undertaken. Allow me to capture some of the common priorities in Southeast Asian countries that was mentioned throughout the sessions. The impact of COVID-19 has urged for increased collaboration and coordination within governments for better preparedness and planning, especially at the national level among the line ministries. Policy discussions need to take place on what countries can do amidst a tight policy space. At the regional level, more intergovernmental dialogue on best practices and to enable countries to align their national strategies with the broader strategies, which basically applies to the ASEAN countries. There's also importance of a regional approach to allow countries to align to the regional economic integration agenda as a major policy incentive. There's also the need for inclusiveness that will leave no one behind and sustainable strategies in various key economic and social sectors such as tourism and agriculture. Enhanced information and data collection and its analysis will also provide for better policy response and ensure that process is data-driven and evidence-based. As a next step forward, allow me to recommend possible actions to explore and ponder. Some initiatives that may help move forward efforts of Southeast Asian countries at the regional and country level that would be of interest include enhancing and strengthening partnerships to implement the SDGs with all stakeholders. The focus for 2021 should be to use the SDGs as a means to accelerate economic and social recovery and reforms. Promulgating better policies and regulations that support sustainability in the region is necessary in sectors such as energy, agriculture, and infrastructure. Further capacity building and education will help officials and the general public to better understand the importance of SDGs and of achieving them. Financing is recognized as a key component for the recovery. As such, the development of the bond market in the region would promote sustainability not only as a means of recovery, but also to improve the financial system as a whole. At the region level, there will be the ASEAN Comprehensive Recovery Framework that will be launched at the upcoming ASEAN Summit later this year. We look forward to studying the framework and its implementation plan to ensure that support and proper implementation will be undertaken. I have of course not captured all the good ideas and possibilities mentioned. This is certainly not an exhaustive list by any means. As part of the exercise, the deliberation and its recommendations from the sessions will be reported to the APFSD in 2021. ESCAP stands ready to support countries in their SDG efforts and look forward to engaging all partners and stakeholders. Once again, on behalf of ESCAP, appreciation to everyone for their active participation in the SDG Southeast Asia Forum. Before leaving, may I kindly request all participants to complete the online survey that has been posted in the chat box. I look forward to your participation next year and hopefully in Bangkok. Have a good day and thank you very much.